Oh.
Hi, my name is Natalie Roy. I'm the Executive Director of the AgriSafe Network and wanted to welcome all of you at the Vermont Training this year. We're very excited that you've all decided to spend the week to invest in your training. I'm actually recording this video from Louisiana. That's where I'm based. You can see from the background the topography is a bit different. It's a beautiful fall day here in Louisiana, and I'm sure it's similar there in Vermont. I'm actually a native of New Hampshire, so I'm a Yankee at heart. I wanted to let you know about the AgriSafe Network because that's an organization that we hope you would consider joining after you receive your training. You'll hear a little bit about AgriSafe during your training, and if you think about what we do, just remember our job is to increase the capacity of doctors and nurses and other health professionals in rural areas to care for farmers and their families. So we want to make it easier for you to reach out to these people and to care for them appropriately. Our organization is a nonprofit organization. We are actually based in Iowa, even though I'm here in Louisiana. I'm the Executive Director of AgriSafe. But we have staff in Iowa that are there to assist you. We also have staff in Minneapolis as well. So you'll learn more about AgriSafe by visiting our website and taking a look at who is available in the country to assist you. But it's important to keep in mind that it's hard to do this job alone, and we know that you might be the only person in the area that you work or the community that you work that understands occupational risks related to agriculture. And so we're here to help you find the resources you need to reach out to this population. Our organization was actually developed by members back in 2003 because we had rural health professionals like yourself that realized in Iowa they couldn't do it alone. They needed to band together and create a network. And so in 2003, AgriSafe Network was incorporated as a nonprofit, and it was driven by members then, and it still is driven by members. And we would be thrilled to have you all as members because you can help shape the direction of our work. We feel strongly that farmers are not getting access to really good health care from people who are qualified. And so the training you're getting this week is the next step in that direction. You're going to receive a level of training that people across the country rarely get access to. And so the fact that the Vermont Task Force has decided to offer this again is fabulous. The training program that you have, as you know, is very diverse. You're covering a lot of topics in a short period of time. When you're done with the training, if you think to yourself, well, how exactly do I do that baseline screening for cholinesterase, or what's the recommendation for respirators based on certain exposures, we want you to think about reaching out to us so that we can assist you. If you visit our website, you'll see that we have resources for clinicians. One example would be the mask board that has various masks and the labels that go with that. That's meant to be used in the clinical setting. You'll see that we have educational materials to assist you in the clinic setting. Also, what we're very excited about is we've been doing for about 4 years now. We have webinars that we offer every month that are free. You actually don't need to be a member to access those webinars. Those webinars are also archived. That is available to our membership. We really are part of a bigger cause here and a bigger movement, and we want you to understand that even though farming in Vermont is very different than farming in Louisiana, where I'm at right now, where I live, or where I lived in Iowa for many years, farming obviously is different there, that we still all carry a very similar theme across the board, which is if we can integrate occupational health care into the delivery of health care to farmers, so we can add the occupational health component, then we can start reaching a population that is really underserved. As you know, farmers are on their own. A lot of them have insurance, health insurance on their own. Maybe it's just major medical. There is no human resource person looking out for them, making sure they get their vaccinations, their tetanus, making sure they're using the appropriate PPE. By joining AgriSafe and becoming part of this movement, you're helping to recognize and increase awareness that farmers who work very hard for our country every single day need access to better health care. And that access might be as simple as training health providers to looking at reimbursement structures within your state, and how, for example, benefit coverage should maybe include spirometry testing for farmers. So I'm giving you a lot of information in a short period of time, but I wanted to just share with you that we're very excited about the training you've invested in, and we hope that you considered being part of our network, in part because we think our membership benefits will be a benefit to you as a professional, but also because we need your voice to help bring this movement closer to where it needs to be. Again, farmers need people like yourselves to advocate for better access to health care, and by joining our network we can do that together. We're definitely stronger together. So please visit our website. You've got great resources this week with the training. If you have any questions, again, my name is Natalie Roy. I'm the Executive Director of AgriSafe. I've been with the program since the inception, and we'd like to have you join us. Have a great week.